My name is Dr. Steve Federico, and I'm the Director of General Pediatrics at Denver Health. I think as a public school system, our two primary goals are still the same: keeping our community safe as it relates to COVID and getting our kids back to school. Those are our two primary objectives. And everything that we do moving forward needs to be focused on both of those things. Fortunately, different than last summer, we now have tools that allow us to do both. So today we learned that Denver will require various settings to be fully vaccinated. Healthcare settings and school settings. Two spaces where, in order to maximize the benefit, people need to be in person. And by their nature, have people gathering inside. And so I think that striving for 100% vaccination in these settings will help to both keep our community safe, but also get us back to our primary goals of educating our students and keeping everybody safe. Number one, it keeps us safe as an individual. These vaccines continue to prove that those who are vaccinated are much, much less likely to get COVID. If they do get COVID, you're much less severely affected, much less likely to get hospitalized, and less likely to transmit it as a result of all of those factors. Having said that, there are breakthrough cases. Some people are hospitalized, and in some cases, folks can transmit, although it is unusual. I think that the greatest statistic that proves this point is that recently the CDC released data saying that 95% of people who are hospitalized with COVID have not been vaccinated. The second major reason outside of your individual health is the health of the community. And so as more of us get vaccinated, there's less transmission. And with less transmission means fewer variants in the future. Encourage all of us to get vaccinated for our own health, but for the health of those around us as well. Maintaining our masking policy moving forward also is a key mitigating factor. When we think about getting back to school, it's all about having the greatest number of kids in school for the greatest number of days. And by combining universal vaccination with universal masking, it really makes it much less likely that we will have a significant number of cases in our buildings and that we'll have significant amount of spread as a result of those two mitigation factors, especially when we combine it with the other DPS 5. We really want to avoid a scenario of significant transmission, which would lead to fewer school days for our kids. 345 million doses of the COVID vaccine have been administered in the United States. That's way more than any other vaccine we give in a given year. It's way more than flu shots are given every other year. The technology behind the COVID vaccine has been around for a while. This is the first time we use it, and that's a fair point. However, the number of doses given, the number of people who have received it, the number of people who have benefited from the COVID vaccine continue to grow the data set that tell us the vaccine is safe, the vaccine is effective. I just can't encourage everybody enough to go out and get their vaccine. The most accurate place that I know of as a scientist and as a physician is the CDC. The CDC has lots of data publicly available for people to explore around both the safety and efficacy of the COVID vaccines. I might encourage people who have questions to go to cdc.gov, explore your questions, and I think you'll find the answers to most of your questions around safety and efficacy.